Alright, so here's an article here from Political Flair. Let's see if we can get this up. Oh, let's see. Political Flair. And the title is, I guess this was an inauguration picture. Trump and Obama. Trump says, no one saw this coming. This exact scenario was war game for him by Obama administration before inauguration. Trump's most cherished security blanket when discussing the coronavirus disaster overtaking the country is repeating that no one could have seen this coming. It's a situation no one has seen before. It's unimaginable, unique, and no one could have been prepared or known what to do. He uses the assertion as an excuse for his lack of response. No one knew something like this could happen. And yet, according to Politico, and there's a link right there, this exact type of scenario was war-gamed out for Trump's staff just days before his inauguration as part of an exercise required by law. See? Required by law. That's important. It's not, well, you feel like doing it or you feel like it's required by law. So there's no way around it. The law says that the outgoing administration has to engage in this kind of activity and let the incoming administration be aware of certain catastrophes or pandemics, anything like that, that can threaten the nation's stability and the economy of the nation. So, as part of an exercise required by law to reinforce the seriousness of the duty about to be placed upon those incoming in the new administration, each incoming administration is put through the paces of a full national disaster. And guess which national disaster faced incoming Team Trump? 7 days before Donald Trump took office, his aides faced a major test: the rapid global spread of a dangerous virus in cities like London and Seoul. One serious enough that some countries were imposing travel bans. In a sober briefing, Trump's incoming team learned that the disease was an emerging pandemic, a strain of novel influenza known as H9N2, and that health systems were crashing in Asia, overwhelmed by the demand. They heard that health officials were warning that this could be the worst influenza strain since the Great Spanish Flu of 1918, and that cases had just popped up in California and Texas. Trump administration officials described the briefings as chilling. The briefing was intended to hammer home a new, terrifying reality facing the Trump administration and the incoming president's responsibility to protect Americans amid a crisis. But unlike the coronavirus pandemic currently ravaging the globe, this 27 crisis didn't really happen. It was among a handful of scenarios presented to Trump's top aides as part of a legally required transition exercise with members of the outgoing administration of Barack Obama. Let's see here. This one right here. Okay. So next time you hear Trump talk about the fact that no one had ever heard of something like this happening, just remember that the Obama administration was nice enough to give him a precise practice test. And because it was the Obama administration, they predicted near the exact type of disaster that would hit the Trump administration just a few years later. Trump wants everyone to give him a break on this. So no one could possibly have seen this coming, as no one could possibly have seen this coming, to excuse his failures. But many did foresee this happening. Time and again, a global pandemic has been listed as something for which the world is overdue. The Obama administration ably handled similar epidemics from Ebola to swine flu. Trump's protests ring hollow. Trump's administration and Trump himself believed that the media was overhyping the threat, but then sought to suppress the numbers of cases by not testing, doing the opposite of what is recommended in a situation like this. Do not let them gaslight us into believing that this was unthinkable. It was predictable enough to be on their practice test. They failed anyway. So Trump's strategy was let's not get into testing. You know, if we test, then we might find out things that we don't want to know. Because a few weeks ago, when that ship was out in San Francisco Harbor, the cruise ship, Trump said, you know, it's best to stay out there at sea. So he's talking about American citizens and other people from other countries. Best to stay at sea, because if they come on land, then those numbers are going to go up. So in other words, you know, they're going to mess with my numbers, and I don't really want those numbers to go up. So it's best to stay at sea. But somebody, I guess, was saying enough in the government to say, well, you know, we can't do this. You can't have Americans on a ship off San Francisco and refuse to have them disembark the ship because some of them would test positive for the coronavirus, and your numbers will go up, you know. So he didn't want his numbers to go up. So if he had it his way, those people would still be in that ship off San Francisco. So this is what we're dealing with here. Now let's see.
Whatever that guy's doing.
Let's see.
Open Teams.
Shut this off. Okay. Now this is a quick one. America needed coronavirus tests. The government failed. This article is from the Wall Street Journal. Yep, right there. Wall Street Journal, owned by Rupert Murdoch, who owns Fox. Fox. The news media that backs Trump, does somersaults, bend over backwards for Trump. And this coming out of the Wall Street Journal. So this is a long article, so I'm just going to read a few lines. When cases of the new coronavirus began emerging several weeks ago in California, Washington State and other pockets of the country, the U.S. health officials worried this might be the big one, emails and interviews show. And the testing program they rolled out to combat it, though, was a small one. Limited testing has blinded Americans to the scale of the outbreak so far, impeding the nation's ability to fight the virus, though isolating the sick and their contacts, public health officials said. As of early Wednesday, about 6,500 people in the U.S. had tested positive, data compiled by Johns Hopkins University show. But the Centers for Disease Control and Prevention had reported only about 32,000 tests conducted at its facilities and other public health labs. Limited testing is also keeping patients like Justin Labor in the dark. Despite recent improvements, Mr. Labor, 36 years old, said he went to the emergency room at Atlantic Care Regional Medical Center in Pomona, New Jersey, Monday with a fever and dry cough, symptoms typical in a coronavirus infection. Doctors admitted him, but he hasn't been tested for the virus, he said Tuesday, gasping for breath over the phone. Everyone just told me there were no tests and I didn't check all the boxes for the state, said Mr. Labor, a social media marketer from Elwood, New Jersey, referring to the criteria that states' labs require patients to meet before running tests. A New Jersey Health Department spokeswoman said the state has sufficient lab capacity to test those who meet the testing criteria. An Atlantic Care spokeswoman said the hospital system is not testing patients in a widespread manner for coronavirus. While the virus was quietly spreading within the U.S., the CDC had told state and local officials its testing capacity is more than adequate to meet current testing demands, according to a February 26 agency email viewed by the Wall Street Journal, part of a cache of agency communications reviewed by the Journal that sheds light on the early response. The agency's data showed it tested fewer than 100 patients that day. When the CDC first dispersed test kits in early February, it showed them to be a network of state and local government labs and restricted testing to people with virus symptoms who had recently traveled to China, where the virus first emerged, or who had been exposed to a known case. Federal officials hoped the virus could be contained, even as they disputed alarms from those on the front lines that the CDC's guidelines weren't keeping up with the outbreak spread. Emails between the U.S. agency and local officials show the government left other laboratories on the sidelines for crucial weeks. The narrow effort is a failing, said Anthony Fauci, a government doctor who has become the de facto face of the Trump administration coronavirus response in congressional testimony last week, that for many in Washington was a wake-up call. While problems still clearly persist, more labs are beginning to do tests and manufacturers are ramping up production. We can expect to see a marked acceleration of the availability and implementation of testing, Dr. Fauci said. CDC officials botched an initial test kit developed in an agency lab, retracting many tests. They resisted calls from state officials and medical providers to broaden testing, and health officials failed to coordinate with outside companies to ensure needed test kit supplies, such as nasal swabs and chemical reagents, would be available, according to suppliers and health officials. When the U.S. Food and Drug Administration, also involved in the response, finally opened testing to more outside labs, a run on limited stocks of some supplies needed for the CDC developed tests quickly depleted stores, lab operators and suppliers said. Hospitals and commercial lab operators said the government didn't reach out to enlist their help until it was late. This was kind of a perfect storm of three separate failures, said Tom Frieden, who directed the CDC from 2009 to 2017, citing the botched tests, over strict FDA rules, and sidelined private labs. He cautioned he didn't have direct knowledge and details. Now, the U.S. is testing far fewer patients than public health and infectious disease experts say is necessary, and just a fraction as many as other countries that rolled out wide-reaching diagnostic programs. South Korea, as of Tuesday, was testing up to 20,000 patients a day, more than half of the total of U.S. patients who have been tested since the outbreak began. The test shortage hurt U.S. efforts to contain the virus, said Neil Fishman, chief medical officer at the Hospital of the University of Pennsylvania and an infectious disease specialist. If we would have had a true understanding of the extent of the disease several weeks ago, implementation of social distancing measures could have prevented the escalation of the disease, Dr. Fishman said. And demand for the test is now huge. Okay, so if we had known about that, if we were doing testing, this social distancing could have been put into effect a long time ago. Yeah, and we probably would have saved ourselves a lot of trouble. Also, the travel ban might not have been necessary because by then it was in the early stages. But now it got to the point whereby it's out of hand. The Chinese were not being truthful. They said it was the infection came from the wet market in Wuhan, China. So that gave the impression that if you eat one of those animals caught in the wild, chances are you're gonna come down with the infection. But if you eat it and you sitting next to me and you're infected, then nothing's gonna happen to me. That's the impression that China gave, but that's not true. It was until the 30th of January that the CDC realized that somebody who was in China and came back infected somebody here who had never been to China and hadn't been out of the country. And that's when Trump put his travel ban in effect from China, Iran, and Italy, beginning January the 31st. Yeah. So this is the long article here, but the gist of the article is that we were too slow in getting this testing going, and one of the reasons they didn't want to get the testing going because the administration really didn't want to know the answer. You know, it didn't seem to like be in his best interest to know how many of these people were infected. And the article, somewhere in the article went on to say, you know, he says like when the spring comes, like when April comes, this is gonna go away. It's like a flu. It's gonna just magically disappear. That kind of stuff. Well, we know that's not true. because there are a number of people, instead of magically disappearing, there are a number of people who died, and they disappear. They disappear into graves, and they're never going to come back. You see? So this is what's going on. Alright. So this is what we have here. We have a massive failure from the very beginning. Administration that was never on top of this, never showed any interest, and decided to accept what the Chinese say, you know, without doing any kind of investigation. And even then, knowing what was going on, because in January the travel ban was put into effect, you know, even then they should know about social distancing. So, you know, so that was January the 31st, travel ban in effect. By then we had a number of people who came from China and so forth, before they had the quarantine for anybody coming back. Any Americans coming back from China would be in quarantine in some military base in California and Texas and so forth. So we knew that. So by then we should have said to ourselves, you know what, there would be people already infected, and we got to find out who these people are, and let's see who came in from China, who was in China, who flew in, and let's check the records and see who entered the country, and go check those people out. You know, so you won't be playing. You won't be playing like a fishing expedition. You have an idea who these people are, who came in the country within a certain time, because to enter the country, you know, you go through immigration or customs or what have you. There's a document and so forth. So the government knows when you come in and when you come out. At least when you come in, they know. So that would be the perfect time. So at the end of January, when Trump's travel ban went in effect for China, Iran, and Italy, right? He had the whole of February went by. He did nothing for the whole of February. Social distancing should have gone into effect and say, well, this is what's going on, and let's start testing the people who came back from China prior to the ban. That's the way that should have worked, and it was a complete failure. All right, and I don't work for them, but yet I can sense that's the way it should have been done, and that was not done, unfortunately. Now let's see here. There are 3 people, the sickest I've been. 3 young people share what it's like to have COVID-19. Yeah. So 3 people here, 3 young people. According to the first study of nearly 2,500 U.S. cases, 20% of hospitalized patients were between 20 and 44 years old. Right? That's a young number, right? 20%. 20 to 44 years old. The Centers for Disease Control and Prevention reported Wednesday. While fatality rates were highest among individuals 85 and older, it's a wake-up call for young adults continuing to gather in groups. Let's go down here. So this guy here, okay. Numerous people in their 20s and 30s who say they have become severely ill have also taken up the social media torch. One of the first tweets to gain traction was from 22-year-old Bajunda Haliti, who described her symptoms day by day. So this is a 22-year-old person who came down with this. And even if you don't die, because most young people, their bodies are set up whereby they could fight off a lot of stuff. However, they will suffer a lot of pain, a lot of damage, probably permanent damage to the lungs. So think about that as you grow older. you know, as you grow older and you're walking up a flight of stairs, you want to have some good lungs, right? As you breathe, because it's not that easy. I remember when I used to walk up like sometimes 14 flights of stairs. Yeah, I used to do that kind of stuff back in those days, and shit. I used to do that. Yeah. Now, no, that's a different story. I probably could do it, but it's going to take me a while to do it. But definitely, you need to have the right lungs working at good capacity to pull something like that off. So Bajanda Halida says, I'm 22 years old and I tested positive for COVID-19. I've been debated on posting, but I want to share my experiences, especially with those around my age, to help bring awareness and to relieve any stress and anxiety some may have due to the pandemic, she said. Jonah Stillman, a 20-year-old author and owner of GenGuru.com, also tweeted his story. As many people know, I was one of the first confirmed cases of coronavirus in Minnesota. I feel obligated to tell other healthy young people that even though they say we are not at risk of serious health issues, this SH asterisk T sucks right here. I am very sick. Take this seriously, be safe. Stillman told Today he started experiencing symptoms about 11 days ago. I had a tiny cough and sore throat, he recalled. Stillman pushed for testing because he had recently traveled internationally. After 4 days of self-quarantine, he got confirmation that he was sick with COVID-19. That night, I went from having what I felt like a head cold to high fever, the worst body aches I have ever had, he said. It felt like I was in a horrible car accident. Right? I couldn't move. The simplest of tasks would wind me over. And this is a guy who is only he's only 20 years old and he's talking like this. He felt like he'd been in a car accident. Yeah. He added, it knocked me out, the sickest I've been. Ultimately, Stillman spoke up because he struggled with his symptoms. He saw friends on Snapchat out and about on different trips, still on spring break. Baffling things to me. People are saying we can't stop living, but we absolutely can stop living for the time being, he said. Another viral post on Instagram came from 29-year-old Tarek Solomon. He started to feel sick 2 weeks ago. Headaches. It wasn't that serious, he told Today. But by the next day he felt terrible. I had chills, body aches. The symptoms persisted for 5 more days, at which point he went to an urgent care center during his visit. He fainted and was put in an ambulance. He stayed in the hospital for 10 hours. 3 days later, when he found out his coronavirus test was positive, his body aches and fever had worsened so much that he couldn't move. The fever went away on the 7th or 8th day, but by then the virus had extended to my lungs, and I started developing pneumonia, he said. There was fluid in my lungs, and I was coughing blood. It freaked me out. I'm still not healed. Solomon didn't tell his story to incite more panic, just the opposite. I don't want anyone to freak out, he explained. I wanted to tell everyone to be careful and stay home until this is over. A friend of Solomon's, Lucas Estok, 36, received his positive test results for coronavirus on Thursday, March 19. Almost 2 weeks ago, Estok started to feel like something was off, he told Today. My eyes were burning, and there was a moment where I found myself crawling on the end of my bed. He had a fever of 100.6 degrees, which lasted for 2 days. He decided to go to urgent care. They said, you need to go home, you need to rest, you need to isolate, he recalled. 2 days later, he developed a cough, and his fever shot up to 102.7 degrees. It stayed in this range for another week. So imagine having a fever at 102.7 degrees for a week. This past Sunday morning, when I woke up, I was having difficulty breathing, he said. The cough intensified. My chest was very tight. When I get up to walk or go to the bathroom, I get a little dizzy or even faint. He admitted himself to the hospital and stayed in an isolation room for 5 hours. His chest x-ray revealed fluid in the lungs and an upper respiratory infection, prompting doctors to say he likely had COVID-19. Right? Prompting doctors to say, what does that mean? That means the doctors didn't have a test. And we talking about just about what, March 19? That's just a few days ago. Yeah. That's just a few days ago. Okay. Over the past few days, Estok's symptoms have lessened, except for his cough, which he says is still moderate to severe. He added, I've never been sick like this before. I forgot what it felt like not to have a fever. A lot of people I've heard from aren't taking this particularly seriously. I don't think they appreciate how the symptoms feel. You don't want this. Estok shared his experience on Facebook, compelling a number of people reach out saying, this feels personal now, and it didn't yesterday, so thank you, he said. Estok's goal to provide clarity through his first-hand experience as it's happening. It can be difficult for people to see something on TV from someone they don't know, having conversations about other people's experiences, he said. But if it's someone you can recognize, it might have an impact, and that's an important point. So this thing can affect people in their 20s, guys from 20 years old, 22 years old, coming down with this. So it's not only old people. The only saving grace here is that with the younger people, they're still alive to talk about it. But older people who get something similar like these guys, they would have been dead already, like in the nursing homes out in Washington State. They would have definitely been dead. So that's the story. So the story is Trump, the incoming administration, they had a practice about pandemic, potentially that can hit. They're aware of it, you see. National security, they advised Trump. They told him, like China, and said, look, it's worse than China is telling you, you see, because you have the CIA, the intelligence community. They can spy. They have people who go in there in China. They can see on the ground what's really going on, even though China was saying no. You know, the only way you get it is if you eat like a wild animal. If you don't eat any wild animal, you don't eat like bats, or you don't eat pangolin or so forth, then no, you don't have a problem. But that's not true. We found out that it can spread human to human, which is and the spread is very very contagious. It's not like, I mean, you can just touch something and somebody comes after you and touch like a table or something like that, and you can get it. And what's worse, you have like doctors get it. One doctor said that he did everything right. I mean, put on the gown, put on the face mask, the shield that covers the face to cover the eyes, plus the mask to breathe, the gown, put on gloves, and the doctor still came down with it. Mm. So what? So what went wrong? What went wrong? Something is. So it's very very scary. And now they're saying they don't even have enough masks. The administration, the federal government, they were caught flat-footed. Trump keeps saying, "Well, this came out of nowhere," Even so, you're supposed to be prepared, you know. The federal government's supposed to have certain things in place for national emergencies. You can't wait until something's going on to start ordering stuff out. No, you're supposed to have warehouses of stuff. Even if they rot, you're supposed to have warehouses full with stuff that in the event of an emergency, a catastrophe, you can immediately send these things out, ship them out, or whatever. You can't be looking around and saying, "Oh, we have to order gloves." So you see people like doctors, nurses don't have gloves, or reusing the face mask and so forth. That shouldn't be. You're supposed to be able to use the mask, and if it's contaminated, you throw it away. If it's not contaminated, you can wear it for part of your shift. If you go to lunch, you throw it away. You put on a new one, and so forth. That's the way it should work. Right now, that's not the way it is. You see, so it's very tough. Right now, I'm part of the Medical Reserve Corp here in New York City, and they sent me a letter, an email actually, that they want people to volunteer. You see, so they want people to go to the website and see where, like for hospitals and so forth, to go in. But that's not easy, because first of all, you had more of a risk at a certain age group. I'm not 20 years old. So, and even if I were 20 years old, still, like these guys just said, they get sick. So can you imagine you going into an environment whereby you may not have any face shield, you may not even have the right amount of gloves or so forth, and you go in there to help, to volunteer. That's not easy. Years ago, I did volunteer, but I volunteered when they had Sandy, when Hurricane Sandy, but this was back in 2012. I think right around October or something like that. And I volunteered like 12 hours. I went in the morning, maybe like 7 o'clock, left at 7 in the night, and they sent me a certificate months later. I got a certificate for volunteer. But that was different. Sandy was with water. And where I live and the place I went to, it was dry. So there was no risk of drowning or anything like that. And there wasn't any potential for infection. So I didn't mind that. They called me up, and a lady called me up and asked me, "Can you volunteer and where the place near you?" I tell her, "Yeah, where it is." And I gave her like a name and so forth, and yeah, I went there. I volunteered 12 hours. I remained there. However, this is a completely different ball game we're dealing with here. I mean, we're dealing with something that you can't see. This is not like a hurricane, like with water that did damage to buildings or so forth. Like during Hurricane Sandy, subways were not running, some of the buses were not running, people couldn't get around, some homes were flooded and so forth. and they needed volunteers. They needed volunteers to help people, like in nursing homes, hospitals, give out medication, and so forth. That's fine. But this thing is different. Here it's like volunteering to be a fireman, and you're going into a burning building, and you don't have your fireman gear on. You have no oxygen tank, you know, and the building is very hot. Obviously, you go in there, you don't have an air tank on you strapped on, and you can't protect yourself. You're gonna burn your lungs, right? When the hot air blast comes out in you, you breathe that in. It's gonna burn your lungs, because you know what's waiting on the other side for you. If you're a fireman and you go in there, just like the way I am right now, and that's the way I feel about that. You see, and right now the way the federal government response was very poor. They're not prepared, and asking people to volunteer, and I mean, it's one thing you get if you were getting paid, but volunteering, like I said, yeah, I volunteered in the past, sure. 12 hours, it was volunteer. I didn't get paid, but sure, in an emergency you volunteer. This is an emergency, but this can lead to one's death. You know, this can lead to one death, and the older one is, the more chances you have becoming, if you get an infection, the more chances you have becoming sick, ending up in the ICU or so forth. And what they're gonna say? Oh, we're sorry. They're gonna send me. They're gonna send. After I'm dead, I guess. They're gonna send a medal or certificate or something. To praise me and say, yeah, he volunteered this and so forth. This. No, I think we have to use common sense. Sure, I don't mind volunteering, but the way the situation is right now, it's not really appropriate, and it's not really fair to send people in there to volunteer, whereby you don't know what you're getting into. Doctors who put on their scrubs, and they put on these gowns, they put on the face shield, they put on the mask, they're getting infected. And I saw one doctor said that. He said he doesn't know what happened. He being infected. And not only him, there are other doctors. There are like two doctors. There was one in the ICU, and I think there's one in New Jersey too, one from San Francisco. And they were in some meeting, and they ended up in the hospital. And some other doctors get infected. And some of them are self-quarantine at home. So this is serious business. But it's definitely, we had incompetence on the part of the federal government from the very beginning. They knew, they got briefing by the intelligence community that China was downplaying the impact of the virus, and it could become a pandemic, leading us to believe that it was only transmitted by eating wild animals. So as long as you don't eat wild animals, you don't eat bats, you don't eat the pendulum or what have you, those kind of stuff they eat in China, if you don't eat that, you don't have to worry. No, that's not true. We found that it's not true. It's not true at all.